Thinking about getting veneers?
My name is Simon Flikier. I'm a prosthodontist. I did my postgrad in Boston University. I was in Boston for 3 years doing my specialty in prosthetics.
He is a part of different dental organisations. And in this real case, he's breaking down who veneers are right for, how long the process takes, and what it's like to take care of them. Let's head to the clinic and hear it straight from him.
So, as a prosthodontist, you do crowns, bridges, veneers, those kind of things. Can you educate us a little bit? How do you decide if somebody is a good candidate for veneers?
A veneer is used when the patient have sound tooth structure and the amount of movement that we need to do on the teeth to achieve a good aesthetic look doesn't require much thickness. So the veneer is a very thin layer of porcelain that is placed over the tooth structure. So the amount of changes that we are going to be able to do are reduced compared to crowns in which we can move teeth around. So it will be the decision between choosing a crown and a veneer will be basically in the amount of sound tooth structure and the amount of movement that we need to do on the tooth to be able to achieve the aesthetic result.
How many days does a person need to come here for getting veneers?
Veneers usually recommend the patient to come to fly in a Sunday. We prepare the veneers on a Monday and we cement veneers on Friday of the same week. This is a patient that wanted to improve his smile, so he wanted to be as conservative as possible. So what we decided was to do 8 upper veneers. So as you can see here, we did a very small preparation of the teeth. We choose the shade that he wanted. This is called a B2, and this is how he ended up looking, smiling. Here is a close-up of his smile. So you can see he has a beautiful white, well-defined smile. Here is with the retractors, and this is one of the most conservative treatments that we can do to improve aesthetics, make it natural looking.
What's the retractors?
The retractor is, we are here removing the lips, so we're seeing much more tooth structure than what people usually see when a patient is smiling. When a patient is smiling, what we see is this amount of tooth structure. So here with the retractors on that picture, what we're doing is removing the lips to have a full image of the mouth of the patient.
How to take care of veneers?
To take care of veneers is same as a crown. It's important, of course, from our part that the veneer is well attached to the margins of the teeth. And from the patient's point of view, it's important that the patient has good oral hygiene using a toothbrush, flossing, mouth rinse, and we always recommend the patient to use a night guard because at night the patient can do movements that could end up dislodging or breaking the veneer. So that's a way of protecting the veneers.
Get a great smile with Dentification. Visit a hand-picked dental clinic today.